everyone. This is Z coming to you today to discuss the topic of Oppositional Defiant Disorder, also known as ODD. In this presentation, we're going to look at how this disorder is defined, how it impacts young people, particularly students in the classroom, some strategies to address the disorder, and some general thoughts about how this disorder and other behavioral disorders are impacting and being impacted by our education systems. So let's get started. In this section, Understanding ODD, we're going to be dealing with what the disorder is, who is most likely impacted by the disorder, how it's diagnosed, and some causes and risk factors of oppositional defiant disorder. So it's important to note that oppositional defiant disorder is not a cognitive disorder. It is a behavioral disorder. Some of the markers are frequent and persistent pattern of anger, irritability, arguing, defiance, and vindictiveness toward family, peers, teachers, when we're dealing with children, and authority figures. So the American Psychiatric Association is estimating that about 6% of children in America are affected by ODD. Typically, the disorder is diagnosed in early childhood, usually around or about age 8 and not later than 12 years old. Although both boys and girls experience ODD, boys are more likely to receive the diagnosis. And it's also important to note that this is different from our typical transitions from early childhood to preteen, preteen to teenage, teenage to young adult, because the symptoms do not get better with maturity. In fact, teens who do not learn how to manage their oppositional defiance just become adults who have the disorder. In order for a young person to be identified as having oppositional defiant disorder, they must be diagnosed by a mental health professional. What the mental health professional is looking for is a pattern of the symptoms: angry, irritable mood swings, argumentative, defiant behavior, vindictiveness, usually towards the people who are closest to them, family members, parents, siblings, teachers, if this is an adult, people maybe in the workplace, a spouse. And most important is that the symptoms are lasting for more than 6 months or 6 months or more. So this is not something where there's a random outburst or today you did something kind of vengeful. This is a pattern of all of these behaviors that last for a period of 6 months or more. Now we're going to look at the causes and risk factors. And unfortunately, there is no known cause of oppositional defiant disorder. However, there are theories circulating within the mental health professional community about the contributing factors to the disorder. So we're going to look at that now. So the two theories out there are, one, the developmental theory, and two, the learning theory. The developmental theory pretty much holds that some children are delayed in their behavioral development from the toddler stage, and because this stage lasts for an abnormal period, the child then develops oppositional defiant disorder. Second theory, the learning theory, suggests that the symptoms that the child is experiencing are basically just reflections of what this child is seeing parents and authority figures use in stressful situations. The child then mirrors those behaviors, and that mirroring behavior becomes a pattern that the child takes on, and then they are diagnosed with the disorder. While there are no known causes of the disorder, there are a clear set of risk factors. Children with ODD are more likely to also be diagnosed with co-conditions of other mental health disorders, such as mood and anxiety disorder, conduct disorder, and attention deficit or hyperactivity disorder. Now that we have an understanding of what this disorder is, let's look at what it looks like in real time in the classroom. How can we recognize students in our classrooms with ODD? How does this disorder impact the students' learning? And what are some best practices and strategies that we can use to address the needs of these students? So what can unaddressed oppositional defiant disorder look like in your classroom? It looks like the power struggle, the lesson that's derailed, verbal and physical rages, usually resulting in discipline referrals, the student who maybe has an outburst because you've asked them to take out their notebook today, a simple, reasonable request in the classroom, or the student who sees another student possibly making progress, feels resentment, and then destroys that student's belongings or their work. The student who seems to be unprovoked but starts shouting and cursing and insulting peers and sometimes you, the teacher. Psychologist Dr. Nicola Davies describes the student in the classroom in the following way. She says the goal of a student with oppositional defiant disorder is to gain and maintain control by testing authority to the limit, breaking rules, and provoking and prolonging arguments. What do you think? Now that we've learned some about the definition of this disorder, how it shows up in the household and in the world and now in the classroom, do you find anything problematic about the above statement or the examples that have been offered so far? Have you experienced any of these or similar scenarios in your classroom? And if so, what usually happened next? Post your comments down below and let me know what you think. We may or may not be experiencing students in our classrooms who are diagnosed with oppositional defiant disorder. But regardless, we all should be paying attention. This disorder and all behavioral disorders, although they may not be classified as learning disabilities, are still impacting the learning process of the students involved. Examples: most students, because of the time that is spent off task, engaged in disruptive, argumentative, defiant behavior, the student then loses significant class time and generally falls behind in grades. Likewise, some students progress to using truancy and absence from school as their form of defiance, and then they are, of course, in danger of failing from one year to the next. These students are also more subject to suspension and expulsion because most schools will treat the disorder or behavioral outbursts with punitive measures. And so, because the students are out of school, they generally also experience severe learning gaps, which increases the likelihood of eventual dropout. Who else is impacted that we need to be concerned about are the other students in the classroom who are experiencing these disruptions day after day, because again, this behavior is patterned, frequent, and persistent. These students may develop a negative attitude toward the diagnosed child because they don't understand the disorder. And in some cases, they develop a negative attitude toward the classroom itself and toward school. All in all, the classroom and the school culture gradually erode when the disorder and the behaviors associated are not addressed appropriately. But all is not lost. I would never leave you without strategies. There are educators and mental health professionals all around the country working on figuring out how to better address the needs of children with ODD and behavioral disorders in general. Some tips they have: setting clear, consistent expectations and boundaries, which we do with all of our students, but it's particularly important for that consistency to be there with students with behavioral disorders. Also, avoid the power struggle. And last but not least, incorporate social emotional learning so that the students can learn to recognize and manage their behaviors independently. Last but not least, in this section of the presentation, we want to look at some life outcomes and statistics for young people with oppositional defiant disorder, and also how looking at and better serving these students can help us examine and expand our practice and improve our educational system in general. Let's check it out. The ODD student after school. No, not after they leave us at 3 o'clock in the afternoon. But what happens when the student with oppositional defiant disorder graduates, leaves our system, and goes out into the world? If we have addressed their needs and they have internalized behavior management, probably the same thing that happens for the rest of our students. But for many students with oppositional defiant disorder, their needs are not addressed and they progress to more serious behavioral disorders such as conduct disorder, where they are now experiencing antisocial behavior, including severe irresponsibility and poor choice and decision making, delinquent behaviors such as truancy and running away from home, violating the rights of others through theft, and physical or violent behavior towards animals and others. Our students are also experiencing disproportionate poor rates of life outcomes after high school. For instance, lower high school graduation rates, 58% as compared to 70% of their peers without behavioral disorders, higher rates of suspension and expulsion, greater likelihood of being arrested while still in high school. These are just some of the things that students can face when they have not learned how to address their behavioral disorder. As the number of children diagnosed with behavioral disorder increases, the statistics related to these children's school success and life outcomes is worsening. As educators, we're called to re-examine how we view behavioral disorder and how we respond on an institutional and systematic level. But thankfully, in looking at this and exploring how we can improve, we will improve outcomes for all of our students. Let's take a look at some new or adopted approaches that school systems and educators around the country are taking to address this crisis. As we begin to look at students who are formally diagnosed with behavioral disorders, it's also making us look at some of the misdiagnosis or overdiagnosis or over labeling of students as having behavioral issues. We need to look at how, when, and why we identify and deal with behavioral issues in the classroom, especially through a lens of race, class, and gender. There are many educators right now at the forefront of doing work at looking at the disproportionate numbers of students who are Black and Latino, who are low income, who are male, who are overly identified as special needs on the basis of behavioral disorder, overly subject to suspension and expulsion, and as a result, experiencing learning gaps and dropout rates that are unacceptable. I'll be posting some resources to that work down below. Thanks. Another avenue that is opening up as a result of us taking a closer look at students with behavioral disorder is looking at shifting from the punitive approach, detention, suspension, expulsion, to misbehavior or behavioral disorder in the classroom, and moving towards either new approaches or approaches that we've adopted from other cultural practices, such as restorative approaches adopted from indigenous cultures, Native American and African culture, mindfulness practices that incorporate meditation and mindfulness that is associated with Buddhism and other practices, creative arts therapies, where we've lost a lot of arts in the schools. We're now having sometimes artists come into the school and provide a form of therapeutic performing and visual arts creation for students. Those things are now being incorporated in schools around the country to address the rising number of students who are presenting behavioral disorder in the school system. So this is the conclusion of the presentation, but I hope not the end of the conversation. Let me know your thoughts, your comments on how oppositional defiant disorder and other behavioral disorders are impacting and being impacted by education from your perspective. Please post your comments below. I would love to hear what you think and also to be able to respond and stay in communication with you. Thank you.